welcome to this Friends of Zeus podcast. This is Zeus. Tonight we've got Michael, we've got Desiree, and we've got Mary. Before we get going, I'd like to get rid of the business. You can find us on under Friends of Zeus podcast on Facebook, Apple, Spotify, Slacker, and we're rolling around there in Rumble.
MySpace.
Did I miss anything, Mike?
Yes, MySpace, BBSs, CompuServe.
Yeah, any BBSs that you may have.
Mm-hmm.
And
Telegraph wire.
Yes.
And ham radio. Yes.
And Pony Express.
Express.
It's a very long process with the Pony Express. We're thinking of getting rid of it.
Yeah.
Tonight, I am filming. I like to give them whatever cred with the 50 people that listen to us. I am recording from Patriots Pub and Grill. They are just the sweetest people. They let me do this show every week with their spotty Wi-Fi, but it works. We get the show out, so I really appreciate what they do. If you're ever in the area, you should drop by. It's a great place. Good food. I'll be eating a burger as we do this show, and it's delicious.
Yes.
That being said, if you don't know the lady behind me here, she's who we're going to be talking about. Her name is RaDonda Vaught, and I'm going to speak for myself. I'm outraged because
Zeus, why don't you explain for everyone out in podcast land what the general gist is? Oh, okay, gotcha.
Exactly. I'm outraged over what's happened with this woman, essentially, and it sounds like Desiree is going to be our expert on this because she was telling me that she knows everything about it. So I'm just going to give a thumbnail. Basically, this woman accidentally gave a med to a patient that, through a series of events, caused the patient to die. For what it's worth, I'll give my thumbnail, and then Desiree can give the details. But basically, there's a machine that you have in a hospital. It's called a Pyxis or an Accudose, or they've got millions of names. They're very flawed. And a lot of the computer programs that we use, if they're not perfectly synced with them, they can cause problems too. So what happened was this lady, there was a lady going down for, what was it, a CAT scan? Desiree?
It was a PET scan, but same type of, radiology.
Yeah. So she was going down for one of these, and often people get nervous about this. So they were going to give her something called Versed, which is kind of a chilly out kind of pill. Mm-hmm. Instead, they gave her something called, and this one you got to correct me on, Vecuronium?
Vecuronium.
Okay, what she said.
We always just call it Vec. I mean, Vec.
I'd never heard of it before, but I'm in psych, so, Mm-hmm. But what happened was, so you got your chill pill, which is the Versed, and then you got the that she just said, that paralyzes you. And when you get this medication, they have to intubate you. Basically, it's putting a tube down into your lungs so you can breathe through the tube. And she didn't know that she gave the wrong pill, which is part of the failure of the hospital. So they didn't intubate her, and she died.
In the PET scan. What happened in the PET scan alone,
while being treated, yeah. And so what happened was the hospital kind of covered it up, from my understanding. And then a year later, when they were about to lose their magnet status, which is this, I don't know if you agree with me, Desiree, but it's just this bullshit, what do you want to, well, how would you say? It's just a prestige.
It's a pretty hat that you wear. I don't know. It doesn't mean anything related.
I'm not getting paid anymore.
We're not a magnet status at my hospital, so I can't speak to whether it's great, but.
Is it like the restaurant rating, like the Zagat rated restaurant?
It's like a 5-star. Yeah.
Mm-hmm.
Yeah.
So
it's technically Zeus. What the magnet status is like you're scoring on Leapfrog, It's what allows Medicare and Medicaid to fund your hospital. And they were standing to lose that. And that's
Wow.
what they forgot.
That's fun.
Yeah, it's a crock. And so what happened is they like fired her,
The problem. 'cause
sent
it's
her off,
Yeah.
and all of a sudden, like a year later, when they're about to lose their magnet status, they're like, oh no, wait, this woman screwed everything up and killed her. Meanwhile, she's working for the year, which I almost got to argue she worked for a year after this and nothing happened. You know, so was it, again, does she deserve to lose her license? This is an unpopular view, probably, but yes, I completely think she needs to lose her license. Do I think that she needs to worry about getting shanked in the cell? Not at all. She
So
should
you-
not be in prison for this
you-
at all.
You do think she should lose her license?
Absolutely.
Oh, okay.
A patient died because she made a mistake, regardless of whether,
There you go.
I mean, there's all those things that are
But
involved.
that's okay.
Yeah. You can't kill somebody. You just can't,
Hi,
you know?
hi, Jack and Dana.
Hey, hi,
Welcome.
thanks.
Thank you.
Isn't it funny that they look like X-Files and her name's Dana?
Yeah, Dana Scully and Jack Mulder.
No,
Yeah, Jack
Fox,
Mulder.
Fox,
Yeah.
Fox Bloomfield.
Fox.
Fox Bloomfield. All right. So I'm sorry, Desiree, this is Jack and Dana. Dana is
Hi, Jack and
also,
Dana.
Hi,
Hi.
Desiree.
she is a psych nurse.
Dana is.
Yeah.
So do you guys work like inpatient psych, like at a hospital inpatient psych, or do you work like at a psych facility?
I work in a
So-
inpatient hospital psych ward
Okay.
currently, but I have 20 years plus experience as a nurse. You know,
Okay.
mainly pediatrics. I'm a pediatric nurse,
Oh.
Hmm.
Also something I could never do. That's
and I
Hard.
work the pediatric psych ward mainly.
mm.
And she's
And-
got me.
Yeah,
Yeah, he's a handful
Yeah.
himself.
yeah. She's got her hands full now.
Yeah.
So I myself, not to brag, I do happen to work for a magnet status hospital.
Yeah, I worked for a magnet status hospital for most of my career.
St. Joe's represent.
I like to think that I'm the worst nurse on the unit, and I'm a pretty goddamn good nurse. So we do have, there are perks that they do get to choose some of the, you know, better. And again, I really do feel like I'm the lowest rung on the ladder, but I really love the patients. I work very hard to like do what I can to help them. We could talk about that for days, but so yeah, I you know, I like to call it slinging goofballs in the nut hut. I'm like right in the middle of it. I'm acute, so my patients are your schizophrenic, people that get wrecked by all these new what do you want to call it, cosmetic marijuanas or
Mm.
boutique marijuanas, just you name it. I got this one patient I'd love to talk about sometime, but she's just we'll call her a hoot, but it makes me very sad how sick she is. But yeah, so that's what I do. And you know, to what we're talking about here, I mean, psych doesn't nearly have to deal with what medicine does. Most of ours is like therapeutic speak, and we just give out the med that we've given out 100 times. We have like, you know, maybe 10, 16 meds we give out all the time. So chances of us doing something like this is less. But to that note, I think what I think happened with this poor lady, I do sympathize, but I still do think that the license at least has to be held in question. I think she was overwhelmed.
Your license for things like this, absolutely. It's
Right.
it's the pressing of charges that's the shock.
That's offensive.
Yeah, criminal charges.
Well,
Criminal
one thing,
charges are shock.
just to jump back, because we did get started, and I don't know, but Desiree, Zeus said that you know a lot about this. Could you give
So yeah,
have
let
a
me kind of tell you.
timeline, like what happened,
Well, yeah, give me one. I don't know what just happened with. Oh,
or
well.
like just a general
so-
overview?
So kind of background on what I do. I live in Kansas, so we are behind on things like magnet status hospitals that won't probably even be here for like 20 more years. But so I don't know how that is to work in, but I do work in a CVICU. So we do like post open hearts, ECMO, stuff like that. So very critical. We use these medications that they were talking about in this case all the time. Well, I shouldn't say all the time. I've actually never given vecuronium. So is rocuronium where I work, but same kind of thing. But basically what happened in this case is this patient gets admitted to the hospital with a brain bleed, a subdural hematoma. And that was on like Christmas Eve, so December 24th of 2017. She's in the hospital for a couple of days. She was in the ICU and then she got transferred to the PCU, so the step down unit. Basically, she wasn't super sick anymore, super critical, but she needed to be monitored, but more than just what a medical floor could provide for her. So during that time, they decided that she needed to get a PET scan, which to me is also odd for a subdural hematoma, because you usually would just get like a CT or MRI. But, you know, again, it's Vanderbilt and they're apparently ahead of the times and are using PET scan technology because it's like colored or something, and it will apparently show like what part of your brain is still alive. I don't know.
May I ask a question about this real quick? May I ask a question? I'm sorry.
Yeah.
So I also, to what you were saying about giving Versed, for me, if you're worrying, I would think, and I'm psyched. So again, you know, whatever, my medical isn't as strong, but my thinking would be that you don't want them sedated because you generally bleed more, right? Or am I thinking along the wrong lines?
No, you want them, people like get really claustrophobic and like freak out in these scans because you're basically going through a tube that's like the size of your body. And so
Gotcha.
it's pretty scary for some people, especially if they have anxiety issues or, you know, just have a history of being claustrophobic or whatever, nervous of what the results are, even for a gamut of reasons you could be nervous for going into one. But yeah, Versed's not going to cause any type of bleeding issues that I know of.
Okay. You see the logic I'm going with though, right?
Yeah,
kind of, but she had the bleed before. She had the bleed when she came in, so the Versed wouldn't have done anything to make it worse, or could have possibly done anything to make it worse.
Is a PET scan a different software, but it's still like the tube thing, like an MRI, like most people would be used to, or? Yeah.
Again, I don't really know for sure, but it's basically like an MRI, but it's like a nuclear medicine type of scan. So they give you the stuff and then you get all radioactive and then you go into the scan and they scan your head and then it's like shows up instead of like black and white images, it's like colored images.
Okay.
And
okay,
so
gotcha.
the color will, I tell them like what portions of the like brain were affected by the stroke.
Now is Versed, and I don't know if I'm saying it right, but is that like a Xanax basically?
It's
basically
sort of.
Yeah, a benzo.
Okay. All right.
It's a lot
we
stronger.
usually call them PAMs.
Oh, it's stronger. Okay.
Yeah. So when you think of like your benzodiazepines, you have like your Xanax, your Ativan.
Lorazepam.
Yep. And then you would have like your Valium. And then Versed is like one of the strongest. Yeah, like in my hospital, when we use Versed, you're either ventilated on a Versed drip or we're using it for procedural sedation.
So this was like a serious, and the reason I'm asking this is I've had MRIs and I was prescribed Zoloft to have the MRI because I went through a period where I was very claustrophobic. I mean, like when they gave you the little thing, like they were like, anytime, I was like I hit it like as soon as they put me in there. But anyway, I was like out, and that was just like a Xanax. So yeah, okay. So this was steps up from that even.
Yeah.
As far as benzos go, it's kind of the nuke. It's like
the top of the line.
Yeah, like if you're thinking of in the looking at other medications, it would be what vancomycin or rocephin would be to like amoxicillin or penicillin.
It's just basically you just got to think of anesthesia.
Wow.
Anesthesia, okay.
That's amazing. I
They
didn't.
usually use this with like dental work as
Sedate
well.
people for procedures.
Wow.
It's used commonly with like conscious sedations, things like
Yeah.
that.
Conscious sedation,
For broken
especially with
bones.
children.
We
Like,
Doesn't
use
that-
it in ER quite often.
So
So
doesn't
if
that
you're gonna
seem?
get like an EGD or like a, a scope done or something, you would use Versed then because it really works really well. In a company with like fentanyl, you would use it, use
Yeah.
them together.
So just as a layperson,
Well, Michael
that
Jackson
seems.
would love it.
But I'm saying, as a layperson who's been through this, that seems pretty severe for a 75-year-old woman to be prescribed for a scan. But anyway, that's neither here nor there.
No,
Desiree,
I mean,
can.
you have a valid point. I mean,
Yeah.
a lot of the like the criticisms of this whole thing, wow, I can see myself in the window. That's cool. There you go. Was that why would you give Versed for this? And the order was 1 to 2 milligrams, which should really only have just been 1 milligram, but it doesn't matter. Every time I've had to do something like this, we've always just used Ativan, like
Yep.
0.25 of Ativan, like not even that much.
Ativan
'Cause you
is
don't
like the
want them to be,
perfect
like,
mid-range.
passed out.
Mhm. Yeah.
Ativan is like the perfect mid-range benzodiazepine to calm you the hell down. Generally, in psych at least, the general dose is like we call it a B52, which is
Yeah.
Benadryl 50.
I love a B52.
They rock, don't they? A B52 is Benadryl 50, Haldol 5, and Ativan 2. And
That's the dog.
so
Yeah,
Right?
And then put some Gedon with that. Perfect.
That's the
Uh,
dot.
the dart.
That's the
The
dot.
dart.
I call it the dot.
I like B52. I'm a
3
plains
mLs of
guy.
pure hell.
Sounds lovely.
And yeah, it does the trick. We'll just say that. Like
Yeah.
I don't know.
so you got the
Sometimes.
Benadryl. Benadryl kind of makes you sleepy. The Haldol kind of makes you like you're walking through water, and the Ativan just chills you the fuck out.
Sounds awesome.
Yeah. Little cheese plate
not
with
afraid
that,
of it.
and
Little tapas.
yeah, tapas.
Strawberries.
Okay, so let's get it back on track. Okay, Desiree. So
Tangent
this
alert. Tangent alert.
tangent. So
You're kidding.
she was supposed
So
to be
she
giving this Versed.
She was prescribed Versed. Now, the
Yeah.
reason that, well, I guess this has not been for sure said the reason why this happened, but it has been speculated that, or I guess what came out in the trial was the family reported when she was admitted through the ER, so 2 days prior to the scan, that she has bad anxiety, she has a history of this, so that's probably why they said, okay, we'll give her Versed instead of Ativan, because maybe she's had 8,000 scans in her history and Ativan's not going to cut it. We don't know, but that's probably why they did that. So anyway, so she goes to the scan and she gets the whatever nuclear stuff that they give you. How a PET scan works is you go to the like waiting area, you get the injection of the nuclear stuff, and then you have to wait like an hour before you can get scanned. And the scan
We're
itself
talking about
takes, like,
contrast, right?
Oh.
it's not contrast. I mean, it's the same kind of idea, but it's like radioactive.
Okay.
So you get that, it has to go through your system, takes an hour, and then the scan itself takes about 30 minutes. So you're laying in that little teeny tube for 30 minutes. I mean, usually a CT scan, you're like in, out, that you're done. No, you have to like lay in there. So she was called to help back up a little bit. So RaDonda that day was working as a help all nurse. Again, we don't have these in my facility. I don't know what this is, but from what I gather is it was
Best
kind
things
of a
happen.
yeah, I mean, we have like, sometimes we'll have like rousters on the unit, but they're just in the unit. Like it's just, they're not getting called out to the ER, to the IR, to the, this, that, and the third place. Like, but it kind of sounds like that's what the help all nurse is. Like somebody calls within the hospital for a task that they need help with and they do it. So she's like going all over the hospital, I think, from what I got there. So she was called from the PCU nurse, called her to ask to go give this patient Versed in the PET scan. She gets down there. They give her the medication. Well, hold on, back up again. So she was in the neuro ICU when she got the phone call. in the neuro, she pulled the med. That's a huge thing that people don't know about. A lot of people are like, oh, how come there was vecuronium available in the radiology department? Why was it so easy to get this? Well, she did not pull it out in any Pyxis or whatever. I don't know, AccuDose machine in the radiology department. It was all in the neuro ICU where she was at when she got the phone call. She pulls the med. How she got the wrong medication is she finds the patient, she clicks on the patient's name or whatever, pulls up the medicines, and it's not in the patient's profile. So she just types in VE for Versed, but VE automatically pulled up vecuronium because alphabetically vecuronium is going to come before Versed. So then she just hits the first thing that comes up. You know, there's some warnings, I'm sure, on their Pyxis or whatever that is like, hey, you know, maybe you should think about your doing. You should probably skip through it.
I'm sorry to interrupt you, Desiree, but let me correct you on that. So what she did was she typed in VER, typing up Versed under the brand name Versed, not
Midazolam.
Generic. So she was like, not here. So she went ahead and typed in VER again under an override, and then it popped up Zirconium. She clicked on that, popped that out of the Pyxis.
Oh.
And then another thing that I noted about this
Generic name. She was looking for the brand name, and she pulled the first one that came up close to the brand name. She wasn't paying attention.
Floppy. Okay.
It's completely an understandable mistake, but the more important thing, and this is where I really do fault her.
Difference. She's given Versed numerous times. Versed is a liquid injectable. The other one is powder to be reconstituted. She reconstituted a drug.
Yes.
Nope. Come on.
There was a lot of areas where she could have been like, what am I doing? But she didn't.
So, here's the most important thing to me.
Come on.
Here's I think the most important thing about this, and where she should have caught herself. And again, I still do not think she should be going to prison. She was under a lot of stress. I mean, I myself right now, I'm coming off of 5 straight days of 12 hours. It's brutal. And I got like 3 hours sleep today. I'm coming to do the show. That's how much I love the show. But
you work night shift?
But yeah.
Go night shift.
The pay's too good. But
I know.
Thank you. Here's the problem that I have. From what I understand, the medication, can you say it again for me?
Vecuronium.
Vecuronium.
Yes. Nuclearonium.
Vecuronium.
Shut up.
It's my it's a great Steely Dan cover band name, actually, too.
You're a great Steely Dan
cover
band name. Okay, so here's the problem. With this medication, from what I understand, you have to draw it, you have to pull it from the machine with 2 people. Like, that's how dangerous it is. And now, correct me if I'm wrong, but that's what I heard, is that this medication requires 2 people pulling it. So that's a problem. No,
I've never. I mean, I work in a facility that we intubate people all the time. I've never had to have another nurse. Again, we don't use vecuronium; we use rocuronium. But no.
Desiree, I didn't pull you on the show to argue with me.
Well, there's. I totally. It would make so much sense to have another nurse because it's a dangerous drug, but there's a good reason as to why that they don't have 2 nurses, because it's supposed to be an emergency medication. If you have to intubate somebody, you don't have time to fuck around and find somebody else to come in the med room with you to, you know, put their DNA sample and also help you get the med out. Like, I don't got time for that. I need to get the medicine. A lot of times, and this is going to be like shocking, a lot of times in facilities that are not ICUs that have a rapid sequence intubation boxes, the boxes are not even locked up and the medication's in the box sitting in the med room.
Wow.
Tackle box.
Wow.
Yeah, a tackle box. Yep. An orange tackle box.
Yep.
Yeah.
We have a tackle box, but it has a B-52 in it.
Well,
now, one thing that I heard, because I did my usual in-depth 10 minutes of research before the episode started.
Intense research.
Was intense. That she was also had a trainee with her.
Yeah.
Yes.
Through all this. Okay.
She's precepting.
She's percepting.
I think she was very spread thin.
Yeah.
System was being very hard on her that evening.
Mhm.
Yeah.
I mean, the thing that threw, well, okay, let's
I don't know.
Desiree finish.
I have a lot of thoughts, but I think that so just like let me kind of get through it before, because there's a lot of places where you could be like, oh, wait a second, that doesn't make sense, because it doesn't. But okay, so she pulled out the medication. Now, yes, you were right how it came out as a powder, and I've never seen Versed as a reconstituted medication. However, that does not mean, and it could not ever come like that. I don't know, but there's been so many times where, you know, you pull a medication out and some random new like manufacturer is now supplying the pharmacy.
Yeah,
so
exactly. They change it.
Yes, so it changes a lot. Like, so I could see where she could pull that out and be like, oh, that's weird, but not think about it like, okay, this never happens, I should look at it. But I don't know.
Yeah.
That's
You learn to accept it. You learn to accept it. Like for me, if you have like an autistic patient on my floor, getting them to swallow an Ativan is not very easy, but they do put it into a liquid and you squirt it in their mouth with a little syringe. First time I saw it, I'm like, okay, I'll just do whatever I'm told because I'm a baby nurse and whatever, you know? And there's a lot.
Trick.
What's that?
The pixie stick. You get a pixie stick and you put the medicine in the pixie stick and just they eat that.
Oh, see, that's considered very unethical.
Oh,
For you guys.
I mean, listen,
that's why I could not.
We could talk stories about things that Mary, you're in nursing school. So much of what they tell you is not how it's going to be.
No.
I've worked in the
For
ER
instance-
for 8 years now, and I've seen
For
8
instance-
years now in the ER as EVS as well as a student nurse now for the last 4. And I'll tell you, ATI, there's ATI World,
There's
and
nursing
there's
world
Intellect
and there's the
and
real
then
world.
there's the
Yeah.
real world.
Well, you know, for instance, a nursing school thought process in this situation is if this lady, Miss Vaught, is on another unit and she is not skilled in that unit, I'm just saying a hypothetical. You would give her minimal tasks that all nurses can do without fail.
Sure.
You know, catheter, you know, just all the little things that would take the heat off the people that are more experienced on that floor. And none of that happened here.
No.
You know what I mean?
No, I mean,
that's
she
the way
was
it looks like.
supposed to go help everyone that doesn't know their, like, doesn't have time to do whatever task at hand. So, I mean, she
She was the float for the day.
mhm.
She was
Yeah.
that.
She
was
was
that
floated.
float.
Floating is dangerous. Sorry.
But it wasn't even
Resource
that she was
nurse,
floating
fine.
for that
Floating
floor. It's like
sucks.
she was floating for the whole hospital. It's a
That's-
very strange
yeah.
situation.
Yeah.
So
Yeah.
I
You know
don't
what I would
know.
do if they told me to do that? I'd be like, yeah, no, find somebody else that wants to lose their job.
So
Not a
I
chief.
mean, I
Fire
didn't
me.
read about the root cause analysis, but I read a little bit about like just the timeline and the facts.
Mhm.
So I would be curious to know, even if they did a root cause analysis, and they might have, of course, but
We're never gonna know.
you know, like once they do that, they start to pick up where in the system they failed.
The
And
Swiss
one of
cheese
the
model.
things is the floating, going everywhere, doing these intense, you know, tasks is a problem. She admitted to being complacent. She admitted to being distracted. And, you know, it's just, there's more people involved if you really like unearth the whole situation.
Yeah.
And it's a system flaw, you know, so
It is a system flaw.
once
It's
we start
100%.
criminalize one healthcare professional, whether it's a nurse, a pharmacist, a doctor, the implications are awful. Like, I'm worried about what comes next if this happens, because A, there's going to be grand exodus. B, nurses, doctors, pharmacists, they're not going to admit to their
No
mistake.
one's going to want to self-report anything. No one
They're
is
not
going
going
the
to be
precedent that
self-reporting
this sets.
shit, you know, and so it's just going to make a more dangerous situation for the public.
Yeah.
And it's
and it's already
not,
unsafe conditions.
it's
As it is,
already
it's already
unsafe because right, it's a flawed system, and we're flawed human beings. And, you know, to criminalize, you know, lose your license, one thing, but to criminalize, you're going to have people leaving the hospital work. They're going to be gone. There's tons of things you could do as a nurse that doesn't include the hospital, and be happy and make money. And that's number one. Number two is no one's going to admit to these mistakes, and mistakes are just going to be rampant.
And what's ironic about that is this case could have very easily, she could have just been like, whoops, put that in the little sharps box, whoopsie doopsie.
You can totally cover
Didn't
it
even
up.
tell anyone. She didn't have to tell the doctor that what she did. They could have just went ahead on thinking this is an anoxic brain injury and called it a day.
Yeah, and then no one would learn.
Right away, she did what she had to do. But I didn't read about this part. Maybe somebody else knows more about it. But I was hearing things about the hospital covering it up.
Yes, the whole.
Okay.
Yeah. So
For like a
let's back
year.
up to. Yeah. So let's back up to like this situation. So she pulls the wrong medication. She kind of thinks, oh, that's where this powder moves on. She has an orientee with her. They're discussing about a bedside swallow study that they're going to do in the ER, which, side note, is also weird. Like, why would you go down to the ER to do a bedside swallow? It's literally drink of water. Did you pass? Yes or no? Done. Like, I don't know why she had to go do that. But anyway.
That actually supports that they were trying to give her the other medication, because that's something you would do if you were feeling like you were going to, you know, have to intubate somebody. If you were going to give that medication, I would think that you would do something like that, right?
There was no, what is she intubating somebody for, though? I'm confused.
For a sedative? No.
Right, that's why I'm saying that's a little sketchy. That's why it's sketchy to me, is that seems like something you would do with the one medication and not the Versed.
Yeah, but the ER thing was a swallow study. Like, literally, it's a, hey, here's a beverage. Can you drink it? Let me watch you drink it. You drink it. Did I cough? No, you passed. That's a swallow study right there.
And
like, I don't know why.
Dr. Pepper is our new sponsor, by the way, so thank you for that.
Thank you, Dr. Pepper, for supporting the show.
Drinking Dr. Pepper.
Goes with
You got my
everything.
heart, drinking Dr. Pepper.
Available at fine magnet hospitals everywhere.
Secret ingredient is
They
pepper.
probably don't even sell soda at Magnet hospitals. Okay.
Oh, okay. Okay.
No, we get the
I don't
fancy
know.
stuff.
Do they? I have a friend that works at a hospital in Vermont, and he's like, yeah, they don't sell soda at the hospital, or like French fries or any of that.
Yeah, that's bad for you. Yeah.
I drink like
We have
8
all that
Coke
stuff,
Zeros
so-
a night.
Yeah, well, they're fully leaded Dr. Peppers, but same.
You know,
Okay, so
so my question, I mean, she seems like she was an honorable nurse. From what I'm gathering, she like did actually fess up to a lot of this stuff.
Yeah.
Once,
like immediately.
She did.
Immediately, yeah, she did.
So that's, I mean, but again, I still stick by. Look, if I screw up and I kill somebody, you deserve to take my license. Now, would I like you to give me an opportunity to prove, you know, defend myself? Yes, absolutely. But at the end of the day, if a life is ended by your hands, you're lucky not to go to prison, and she should be lucky not to go to prison. I don't get a hostile, malicious, Black Widow,
It's a mistake.
vicious vibe off of her. She seems
Right.
Yeah, but
what's that?
negligence doesn't mean intent, though. I mean, that's the very definition of negligence, right? It's not intentional.
Yeah.
I mean,
So-
you start talking about kids, maybe yes, but with this, I don't think that malicious is where it's like malicious negligence. Like, I don't give a fuck because I'm going home. I'm gonna have some beers, whatever. Not my fault. If she was
hold
doing
on.
that,
There's a ton.
nail her.
There's so much more with it. So she whatever draws out the medication. I guess doesn't. One of the biggest arguments was she didn't look at the label and see that it said reconstitute, or I guess she did maybe look at the label and it says reconstitute with 10 mils of whatever. That was a huge thing that was not relevant, but it doesn't matter. She reconstitutes it. She pulls it up. She pulls all 10 mils up. Okay, all 10 milliliters. When you give Versed, there's only 2 mils in the bottle.
Mhm.
Yeah.
Those
So-
are the small little bottles.
Versed comes in 2 vials. One
Yeah,
is for
like
surgery, and that's 20. And then one is for sedative, and that's 2.
And that one would be what's in the
That's all it
pieces
comes with.
on
Student
units.
nurse.
Yeah, man.
I got an A in pharmacology, okay?
Yeah.
So
I tried a lot of pharmaceuticals when I was younger.
I know you did. I witnessed half of them.
That's true. You were there.
probably don't try Versed or Vecuronium though. Probably don't do that.
Crazy.
Yeah.
So
Probably.
she draws up
I
all
don't recommend either.
she draws up all 10 mils of the Vec, and so that should have been another red flag, but okay. She then goes to give the patient the medication. Well, turns out, oh, there's not a scanner in the radiology department at all. Nowhere.
the big problem.
nowhere. That's the biggest problem. There was not a scanner in the radiology department. So she called the charge nurse on the PCU, and she says, "Hey, is there this order?" And she says, "Yes, that's an order." Okay. So she's looks at the patient's
Oh.
band, and she verifies that, which we can revisit this afterwards. This is what happened. She looks at the patient's band, she verifies that the patient is who they say they are, and she gives 2 mils out of the 10 mils of the medication, flushes it, and leaves. Now, there was a huge argument whether she should have been monitored or whatever. That was a huge thing. There was an order for her. She didn't have to be monitored when she was in the scanner. My facility, you're monitoring that patient because at that point it becomes conscious sedation. So I don't know, Vanderbilt did not have a policy for conscious sedation at the time. So that coupled with the actual order from the doctor that they did not need to be monitored while going down for the PET scan was the reason she didn't monitor the patient. So she
In the
then
hospital
goes,
that I worked at, you had to be certified in that to even.
yeah,
be in-
there's a class like that you got to take about conscious sedation, and
Yeah.
And you're
you
still
got to
probably
learn
doing
how
it
to
with a
read
doctor
internal
there.
CO2s. Like, no,
Always.
this is not if they're doing a procedure, yeah, like if they're doing a bedside like EGD or something, but not like a scan. Like a doctor's not there for a scan, but still it falls
Fair
under
enough.
the category of conscious sedation. You have to do the same type of thing, monitoring wise.
In the ER, you have to be CEN certified to do conscious sedation.
Yeah.
At least in Florida,
everywhere.
you do.
What's
You have to have
CEN
a
certified?
Yeah.
certification.
My
like-
problem
I mean, at
is,
least where I worked, you had to be certified to even touch those meds.
What's
Here-
CEN certified?
In
CEN, Certified Emergency Medicine Certified.
Okay.
Yeah.
so my huge problem, and it's kind of double-edged because, you know, we do know the 5 rights, and for Jack and Mike that might not know this, you got the 5 right, or is it it's called the 5 rights, right? So it's it's right person, right dosage, right medication. I did this in school so long ago. Let's see if I can
right
still do it.
route.
Right
And right
right
time.
right city.
And then the 6th
Right.
right is patient refused.
But
I've had
basically
this
there's
pounded
these
in my head for the last
there's
6 months.
these five rules that you follow with meds that are going to keep the patient safe.
Mhm.
And the machine, although I love it and it helps a lot, it makes you very complacent because
Yes.
it does like 3 of those things that we were taught in and out day after day for 2 terrible, torturous years of school.
Yeah.
Not Zeus, not just your 5 rights, but
Can
you
you
also
state your
have your
name and
3
date of birth for me? Okay, thank you.
Yeah,
Okay,
hello.
yes,
Yeah, we do
Yes.
that all the time.
Wait, Mary,
Exactly.
Mary, the
It-
3 what?
The 3
Mary.
checks for medication.
Yeah, I didn't learn the 3 checks. I saw that when
That's
I
what you
googled
asked the
it
3
today,
checks,
and I was
which
like,
is-
okay, what's
Well,
the 3
you're,
checks?
you're not
One
magnet
is
status for what
verified-
it's
That's
worth.
true. That's
Patient
true.
date of birth, you have to have your 2 identifiers. Second is you have to verify with the MAR. And
Right.
your third is you have to verify with another nurse. That's what they're teaching us now.
Yeah, that does not happen.
See,
I
here-
know that it's happened, but that's
Is
the
that,
3
Mary,
checks.
is that
Teach us
critical
in school now.
care? Is
No,
that
that's-
emergency and critical care, or is that just med surge everywhere
just-
now?
RN, med surge.
Wow, you can't even get somebody to co-sign.
I know, right?
Can you
Listen,
imagine?
Let me tell you how hard it is as a psych nurse to go, what's your name and date of birth? Jesus Christ, 800
Yep.
BC. I'm done.
Okay, we'll
All
go
right.
with that.
I
What you
remember
gonna do?
admitting
Ask,
you. So
ask
I'm gonna go with
somebody's
what I
name,
got.
date of birth with the ET tube down their throat? No.
Exactly.
So
Exactly.
here,
That's what verify their band.
Yeah,
So-
Mike.
That's why scanning their armband is your right
Yeah.
patient check. Or
So
your,
that-
Again,
what?
I'll just say a hypothetical situation that may have happened where a patient traded armbands with somebody else down in the ER, and they got on our unit and started kicking doors down and punching people.
It would not be, you'd say things are surprising, but I've seen a lot of shit
Yep.
in medicine.
Yeah.
And you're like, yeah, stuff that would happen, and I would not blink an eye at it.
So here's two things as
I'll be right
a
back, guys.
layperson, like that, but I'm in construction, so like procedures, policies are big things. It's like my bread and butter. But there's two things that stand out to me as a layperson. One, I know a few pharmacists, and it seems odd to me that at that critical point where the medicine is being distributed, that is automated, or that there's not the human to human handoff, because I mean that just seems like it's ripe for issues, because systems break down, and that's the whole reason you want to have that human to human. So that's one thing. The other thing is, like we brought up earlier, the fact that she had a trainee with her. When I've trained people, like I'm by the book, man. Like if someone is shadowing me and I'm going out on calls and I'm going out to job sites and stuff like that, I'm following OSHA stuff. Like I'm doing stuff I never do, because I'm trying to give an ideal example.
This is how you really do it, but this is how Michael does it.
Kind of. No, yes, but what I'm saying is that kind of threw me when I heard that she had this trainee, and I'm not trying to throw her under the bus, but I'm saying as a layperson, those two things jumped out at me like, whoa, that just seems bizarre. Like why, like, again, I get alarm fatigue. I've been in hospitals. I mean, I had a friend that was in a hospital for 8 months. I went to see him like every other day. And like, I was only in there, I don't know, an hour and a half at a time. And I was numb to all the alarms going off, right? Much less working there
Everything
for
has an alarm, everything has a pop-up
for a
screen,
shift.
and everything has.
Yeah, it just goes right over your head.
Hey, Desiree, do you happen to know, like, if this was a consecutive third shift for her or a...
So it was her third shift, like out of three,
Wow.
3 out of 3.
The third shift is the cursed one, you know it.
Mm-hmm. They said that was
Everything after
was
is
another.
kick.
But she never said that she was tired. She just said that like that was her third shift. Like she never, she said that she had an orientation and that may have caused her to be a little bit distracted while pulling medication out.
She said she was distracted.
But she didn't report that she was tired.
What does third shift mean? Just to explain it.
In a row.
So in medicine, yeah. So we only have to work
3 shifts in a row.
And a shift is how long?
12 hours.
Is what it is. She's probably used to working
12 and a half.
Wow.
Yeah, I mean, well, it's supposed to be 12 hours. It's always 13, 14 or whatever.
Always 13, 14.
So because we only work, because that's for your 40 hours, it's 36, whatever. 36 is they count full time. So you work 3 12-hour shifts a week.
I got you.
You can choose how to work those. Well, in my facility, that's how we do it. You can choose to work like Monday, Wednesday, Saturday. You can work Monday, Tuesday, Wednesday. It doesn't matter what you can. Some people I like to do them all in a row. And I'm like an outlier. I think my third day is easier because I am now tired. So I'm going to actually sleep between shifts. So I'm going to be rested. But I mean, a lot of people aren't like me. So
I think why another reason why this story is very alarming and getting a lot of notice is, again, for speaking for the vast unwashed of us out there that aren't in medicine, there is a perception, right or wrong, that work within a hospital is like precise, exact, clean, perfect. Everything is like, I mean, when I've gone into a hospital for an operation, I'm like shocked, like how cash everything is. It's like, to me, it's like a momentous day. Like I'm like going to remember this the rest of my life. And for everyone there, it's like Tuesday, So
yeah, like I do heart surgeries. I'm like, it's just another day. You're going to be fine. Shut up.
Yeah, it's like whatever. So I think this is alarming to people because, like, right or wrong, there's a perception that everything runs like clockwork. And from talking to people I know that are in medicine, it's not. The truth is, it's like every other job in the world.
In a perfect world,
that's imperfect.
in a But in a perfect hospital nursing world, it should run as the public's perception.
Yeah, it should.
But it is not like that, because that is not how, I mean, yeah.
And the
we would
stakes
all
are
love
so
to
much
have
higher.
What
The
they
s-
say that we're supposed to have, but
The stakes are
It also
huge.
depends on your team. It depends on who you're working with. Because in the
if you got the
ER,
A team with the Z
green
team, like,
teams, and then it's a complete shit show from 7P to 7A. Like,
mhm.
it just depends on who you're working with and what's coming through the door. Like,
Yeah,
shit happens.
yeah.
Mhm.
But I'm
Yeah,
just saying,
so-
I think that's why this story is landing hard. I guess what I'm saying is the people that are like, oh man, she should totally go to jail. This is horrible. I think it's coming from this perception that she is so negligent because the system is perfect. And this
The
person,
system is not
was-
perfect.
I know, but I'm saying, but that's the perception
The
of
system
like
is
the
set up
general
to
people.
fail.
The system is fucked.
Yeah,
Like,
But that's the story. I think that is the story in all this. Is
Well,
it is the procedure. It is it's the hospitals. It's again. I'm still shocked that there's like a machine involved in this medicine distribution. I
let
never
me
knew
shock you
that.
a little bit more.
Mike, that's
let me
not
shock you a little.
new thought. That's
I'm-
not a new thought. Like
They've
we
had
know
AccuDose machines forever.
Yeah, I just
I
didn't
mean,
know
what are
that.
you going to do? Have a pharmacist first of all, have a pharmacist employed on every single unit of a hospital, all at 24 hours a day, sitting behind a counter making medicines. Like,
Yeah, I don't know that. I'm saying
mean,
it's just perception.
Allow me my argument to that. They could afford it.
Yeah.
Vanderbilt could
not
afford
have?
it. Yeah, Vanderbilt.
Why
But there's
not
probably
have
not that
that?
many pharmacists that are available to be staffed for that. I mean, how
No,
many
but you
units
could
are in a
have farm
hospital?
techs. You could have farm techs that
But
have a
it-
pretty decent knowledge.
It's
Farm
also
tech's definitely not going to be bringing you your Versed or your Vecuronium.
it's
No,
also
but they'll give you the warning. A
Yeah.
person right there saying,
But-
don't do
Yeah.
this.
But I
So
think it seems like everyone I know that works in medicine is way overworked. I have a family member who's a pharmacist, and he tells me these stories that are just shocking to me, where he's got like a 10-hour shift, but he ends up working like 14 or 15 hours.
Yeah, it's never
He-
what they
He's
say.
under like
In the last 5
people
days, I
coming
did
in.
60 hours.
The people coming into his that he serves they're stressed out, and so he has to deal with all this abuse like all the time, like he's taking all this incoming from like the general public, and I'm just like, man, I thought being a
and from the nurses
pharmacist
too. To
was
be honest,
great.
like I'm always called pharmacy complaining about something. So
Yeah, but I'm saying the whole field.
That's
I'm
me.
just saying nurses, pharmacists, doctors. I think everyone is just abused by the system.
each other, outsiders, the system, the administration, the patients. Like,
You know,
it's a
let me-
never ending.
let me
That's
see if
right.
you two girls agree, or you three girls agree with me.
Yeah.
Doctors crush it, actually. 90% of the doctors I work with are freaking amazing. But you have that
You ever
one where you
heard
go,
of July 1st?
what's that?
You ever heard of July 1st? It's
I've
coming.
heard
What's
July
that?
1st.
President's Day.
What's
July
this?
1st is
Watch out
when
for
July
July 1st.
1st is the day that the baby doctors get to practice medicine for the first time ever.
Oh, it's a set day.
It's a set date in the entire country. Yeah, I don't know why it's the same, but it is the same
Zeus,
everywhere.
You probably don't work with residents. There's probably not a resident.
No, I work.
All I got
Again.
to say is, do not go to the hospital like the entire month of July
Wow.
Okay.
ever.
Okay, wait. Let me write. Hold on.
Okay.
Let me write
So
this.
in
one.
answer to
July
that,
through December is
Practicing
pretty rough.
medicine, they literally are practicing medicine. They're
Yeah,
starting
they're-
out, they're using diagnostics to do everything for them. Everyone in CT and imaging hates them.
Because
Everyone-
everyone's getting an MRI for everything, like, or CT, sorry.
Dude,
It's
I'm writing
ridiculous.
that down. That's good
Everyone's
stuff.
getting a flu COVID test. Everyone's getting a UA for stuff they don't need. They probably got 8 UTIs like coming in from their folio they've had
Everyone
for
in the
18
ER is a
years.
separate
They need a
workup.
UA.
Everyone is, yeah. It's
so that's
ridiculous.
what it's like to not work for a magnet hospital.
So that's
Just
why
kidding.
you have nurses. I work at a teaching hospital, and I think Vanderbilt is a teaching hospital, but maybe that doesn't qualify us for magnet status. I don't know, but
Magnet is stupid. That's
I
how
will
Um,
say,
I work
Nurse-
for a magnet hospital and it is also a teaching hospital.
okay.
Yeah.
Okay.
I will say, I mean,
And they have
nurse,
July 1st there.
as a
Magnet means a lot of money.
Yep.
right from the
And
government,
that's
yeah.
why Vanderbilt, I think, got crazy.
Yep.
I'm also going to throw this out. Vanderbilt, has anybody thought about Illuminati?
They lost their minds.
Because it's the money. It's always about the money. I mean, what Mike, to speak to what you were just saying,
Mhm.
you know, not only is it, you know, a stressed system, it is a business.
Yeah.
Cha-ching,
It's a huge
cha-ching,
business.
cha-ching. You know, it's so there's that whole aspect of it too.
Yeah.
Especially Vanderbilt, because I'm pretty sure they're a for-profit facility. So
Well, they're Illuminati.
I work for a for-profit hospital. You know, the first budget cut they made.
I do as well.
First budget cut they made during COVID was housekeeping.
Wow.
So I work for a not-for-profit, but it's still worse because that means we do more shit to people because we can't just kick them out, you know. Or
Ladies,
I
it's
say that
not a
lightly.
competition.
We can't just stabilize
We're
them
working
and go.
together.
Look, I had a hip replacement, which Zeus
It's
loves
terrible.
to
I
talk
wish I worked
about.
for a for-profit.
Only
And-
one.
Only one, and
Half the job.
the orthopedic surgeon, a gentleman, he's awesome. He had this convertible Porsche with rear tires on it that were like 20 inches wide. This thing was a hot car, and I'm like, I'm so happy that this guy has this awesome car. Like, I want people in the hospital who are helping me to be loving
As
life,
happy
like
as
help,
possible.
yeah, making tons of
course.
money, for profit, more money, make it
course.
rain. Like totally, man. Like those people should be well taken care of. But every
More to
time I've
lose.
been in a hospital, either to be with someone else or myself, you never see a doctor. It's always the nurses that deal with you 99.9% of the time. I mean,
Yep.
they're the ones doing all the work.
And that's part of my problem with this whole situation also is 1 year ago when we got attacked by the plague, we were frontline warriors. We were heroes without capes. We were, you name it. And now
it's
this
just a bunch
poor
of hose
woman-
work here signs. That's
Yeah.
what's going on. Like,
Nurses are a horny bunch. But the point being is that we were like the shit for a year. We were, everybody loved nurses. Nurse.
Yep.
And now this poor woman, again, neglect aside, I'm just saying she doesn't need to go to prison.
No.
Yeah, no,
I don't
I
think you should go to prison. either.
Vanderbilt
Yeah,
needs
but-
to be held responsible and
They
accountable,
do.
not the nurse.
Yes, they do.
This all falls on the hospital for allowing these practices to happen
Yeah.
within their walls.
it's a
I blame-
procedural
The nurse.
issue.
They'll get
So
sued.
not only did they not provide a scanner system in the radiology department, whatever,
That's
but like
ludicrous, by
they
the way.
were transitioning to Epic from whatever system they had before. I don't know. Well, I guess when they transitioned over to Epic, there was a delay in, so like you put the med in, whatever goes to the pharmacy. Pharmacy gets the order, they say okay, and automatically it should, or like a minute later, go to the Pyxis or whatever, and then you pull it out. So because they were transitioning over to Epic, there was a very, very long delay in the communication of the systems. So Vanderbilt was actually instructing nurses to override medications. In fact,
Because
this
that's what's
particular
Wow.
patient, this particular patient in the 2-day
Systems
stay that she was
problem.
there had 20 separate medications that had to be overridden to given her.
Wow.
That's like her meds, that her scheduled meds that she's supposed to have. That's like a Tylenol,
But she screwed up.
this, like
No, no.
20
And
medications.
every
other
med
than
she
this.
was supposed to be given, her PRN meds as well as her scheduled meds, were all
Yeah.
overrun.
They're all overridden.
They were all
And they were
overridden.
instructed to do so. There were like S-bar notes
Really fucked up.
sent out about this. Like, this is how we're going to overcome this problem, is to do this workaround.
Wow.
Yeah, it's a travesty across the board. And for you guys that don't know what S-bar is, that situation background, A is
Assessment and recommendation.
And
assessment,
yeah.
and then R is how you respond.
resolution
Well,
or whatever recommendation.
The one thing, so here's a question. So why isn't, because I'm sure this sort of stuff, unfortunately, happens all the time. So why why
does.
haven't we seen more of these cases? In other words, is this
Because they don't get criminally charged.
so is that in other words, is it a legal system problem, or is this a medical system problem that this woman is going to jail?
I don't
It
know.
sounds like it's a
money
legal.
problem.
It's a legal system.
It sounds like a
problem.
legal
At
system
this
problem.
point.
Medication
But-
errors happen all the time. Like
All
there's
the
so
Yeah.
many of them.
And
Yeah.
people die because of them.
Mhm.
All
Like,
the
just,
time.
like I think 27.
Here's the issue
No.
with Vanderbilt. The issue with Vanderbilt is the mayor of that city funds that hospital. Everyone get kickback from that hospital. That entire community is centered around that hospital. And when somebody put in that little, note in someone's ear a year after the fact,
Prosecutor.
Medicare and Medicaid got involved and said, "Oh, we're pulling our funding."
Wh-
So the entire community came down on this nurse.
Where is Vanderbilt? Where is Vanderbilt?
In Tennessee.
Nashville,
Tennessee.
Tennessee.
Oh, wow. Okay, I didn't know that.
And the entire
Um,
community is in bed with that hospital.
Is this like
That's
Gloria
the
Vanderbilt, like the
You know
Vanderbilts?
what that's called? That's
Vanderbilt.
called politics.
I don't know.
What'd you say?
Politics.
I'm gonna look this
Yeah,
up.
politics.
So
And I speaking for most nurses, I mean, okay, so there's an old cliche, nurses eat their young. Okay, that's fine. My theory is that when you deal with the chaos that we do, and then somebody new comes along and asks a stupid question, you get a little frustrated because you're like, just go through it like everybody else did. But the fact of the matter is, they are not just they're devouring this poor woman for something that I think on less devastating levels happens. I'm not gonna say frequently, but I've been doing it for
Often.
5 years and I've seen a few mistakes happen.
If you look up statistically, medication errors, they're like one of the top killers of people in the
Yeah,
country.
yeah.
that and falls for some
Right?
reason.
So,
Gravity,
but to have somebody criminally
gravity's out to
charged
get us.
anti-gravity.
is new
Yeah.
and unusual. It's a problem.
I'm hoping that well, let me ask you, Desiree, is there anything going on as far as trying to reverse these charges, or is she's just
Oh, good question. Yeah.
well,
So,
they haven't even actually sentenced her yet. That she just got the verdict just came out like a couple weeks ago. So
May
um,
13th.
I'm sure they're going to try to appeal or try to do clemency or try to file like the entire, and we can get to that later, but the entire case was very, very mismanaged. It was poor counsel. I mean, everything, like it just,
She has
the
the
case is
ANA
not very good.
I read the ANA statement. I read the American Critical Care Nurses Organization statement. She has a lot of influence, organizations to back
There's a lot
her
of people.
up.
There's not like a reputable institution that is siding with the DA. Not a single
No.
one.
None, including the victim's family.
Yeah, I
Wow.
don't even want to say it.
That's correct. The
So
victim's
let's-
family's all for her.
Let's talk
They're
about that
all
for a
for her.
second. So medication error happens, patient dies, whatever. Vanderbilt,
Whatever.
you're supposed to report.
Whatever.
Yeah,
Like, okay.
Whatever.
Whatever.
That's the fact. That's called a fact. We'll skip over it.
Okay. People die.
She does die, and it's very unfortunate because they coded her, and she was without oxygen for 30-ish minutes.
Yeah.
Jeez.
And she died a really terrible death because she was just, I mean, you're paralyzed, but you are 100% with it. You're not sedated, so
So you're
what's
like
going
seeing
on.
this happening to
You're-
you.
Wow.
It
You're like-
paralyzes the diaphragm, which and
You
you're
can't
basically
breathe.
suffocating. Yeah.
Mhm.
You
You ever hear of
suffocate.
like anesthetic awareness? How people
So
are like awake
I
during
was
their
also
surgery?
reading this, that they had a neurologist speak, and he said that it's uncertain whether or not the medication killed her or her brain injury. It's not to be
Yeah.
proven. And then the medical examiner also said that there was no way to prove that the medication killed her because they couldn't get a sense of the dosage or what dosage.
Yeah, because remember, she pulled up all 10 mils of that Vec, and she only gave 1 to 2.
She gave 2.
So
like you said,
is
right?
that enough to really fully paralyze somebody?
Oh,
Would be
gotcha.
that 10 milligrams
But
is the typical
because of
dose
the
if it
nature
comes
of
up
the
in a
drug,
vial.
it's metabolized very quickly through the system.
And we
So
don't,
technically, she could have died for another reason. It just could be like a series of really unfortunate,
Yeah.
it could be.
corresponding
It could
issues.
be the brain bleed could have got worse in the scanner for,
Right.
if she was, anxious, she could have smacked her. Who knows? I think,
I mean,
this is what I think.
it sounds
I
like-
think that
Wait.
she didn't,
Shh, wait.
go ahead.
Yeah, Desiree.
Oh, I think that she probably wasn't fully paralyzed, but she was just enough to where like she couldn't effectively breathe well enough to actually like ventilate and oxygenate and stuff. And she probably had a buildup of CO2 causing her respiratory tract to then like fail. That's what I think the sequelae events was. I don't think that she was immediately paralyzed by the medication, just like a little bit. I mean, and that's possible. I mean, I've had patients on rocuronium drips wake up before, like, whoa, buddy.
Wow.
But like, so it can happen.
We've had
Now, you were
people
saying that the
first of all,
family supported her?
activate themselves.
So the family,
Like-
so when the patient died, what's supposed to happen when the hospital has a sentinel event is they're supposed to report it to CMS. Vanderbilt did do that. She died on the December 27th. By January 10th, Vanderbilt had already settled with the family. Settled
Had
it, paid them
settled?
off, settled it. Yeah, what's that, 2 weeks later? Yeah,
Oh.
2 weeks. They're paid them off,
Yeah,
to
I've
shut
seen
up and
Yeah.
made them sign
Shut up money.
yeah, hush
Shut up
money.
money.
They
And
also
then-
reported her death a natural cause.
Yes, but they
Yes.
reported her death a natural cause because when they reported the death, so they reported it to the coroner. I don't know how to Vanderbilt. At my facility, if your patient is there less than 24 hours, you have to report it to the coroner. It doesn't matter why. I don't know if that's why they report it, what the reason that they report it to the coroner, but when the neurologist reported it to the coroner, he did not say anything to the coroner about the medication error. So when the coroner did the autopsy, they're looking at it like, well, this is an anoxic brain injury. Patient had a brain bleed, makes sense.
Yep.
Yeah. So that's why it was ruled a natural death or
Natural death.
yeah, because to the
Due to
coroner looking
sustained
at
heart
it, it makes
injury, yeah.
sense.
Wow.
And that's what I'm saying. This case could have so easily been covered up if she just wouldn't have said anything.
Yep.
Because everything makes sense.
She did the right thing by saying something.
She was an honest nurse.
She was.
Good on
You're
her.
supposed to be.
Yeah.
You're supposed to
And
be.
that's what it was-
But honestly, people aren't going to do that anymore.
No,
If she does an ounce
That's
of jail
scary.
time,
that's scary for nurses.
No one's
that's scary
gonna
for
report
I'm
patients.
afraid of the shift. I'm afraid of the shift. This
terrifying.
is a paradigm that could go very, very, very south.
Okay, think of it
yeah.
like this. This is a good psych example. You guys give Haldol,
Uh-huh,
IV
all the
Haldol a
time.
lot. Okay. How much Haldol do you give when you get it?
5, 10, maybe.
10
How much?
tops.
I just
Gallons.
thought that it was
A gallon.
Okay.
10.
What
5
would
to
you
5 to 10.
we can cut this part out of the podcast if you want, but I mean, if your doctor orders 1 milligram of Haldol, how much are you going to give that patient?
2.
1. I know what you're getting at.
1
You're talking about
milligram
what they
of
call a
Haldol?
nursing dose.
Yeah. Okay.
You're talking about
so
the
let's
nursing
just
dose.
say-
Yeah.
Yeah. So let's just say you decide they need 5 of Haldol. You just give them that whole vial.
No.
They die because they're, I can't even think of PRN rules. So
You're talking
long,
about an
whatever.
SVT or a QVT. You're talking about
Their
the
QVC
heart.
their
Their
QV
QT interval
whatever. I
is-
can't even.
is elevated.
It's now
and
prolonged, and
prolonged.
so they block out. Okay, so
Yeah.
But you know that you gave them way too dang much, and you weren't supposed to. But and now you ain't gonna say nothing because oops, I wasn't supposed to do that. They
nobody's
just got
gonna
one.
say anything about anything.
Nope.
Well,
Yeah.
again,
I don't
imagine
really
the-
think that's like
Including
a system
doctors,
there.
pharmacists, everybody.
Well, here's the
No.
thing,
It's
though.
just
Dana
nurses.
will back me up on this. With us, again, we got 20 meds we give. So
Mhm.
as far as a med error for us, it's significantly lower. What our problems would be like giving IVs, not Dana because she's got medical history, but a lot of psych nurses don't have a whole lot of med, anything. So
Yeah.
I could give a catheter if I was forced to, but I'm going to choose not to every time if I can, because it's just, you
A
know,
nightmare.
It's, well, no, it's more the muscle memory of it. Like I remember
Exactly, muscle
everything,
memory. Mhm.
but
You
and I
don't
could do
use
it.
it, you lose it. Yeah. You don't use it,
Here's
you
the
lose
thing.
it.
I know I could do it.
It's skills, monkey.
If I
those are
had to,
monkey skills.
I don't know that every nurse that I work with on the psych floor could do it. I'm unwilling to, because that's somebody else's job. That's medicine. If you've got somebody there that has something that could put them in a great deal of harm's way, like an infection or things like that, they shouldn't be on psych, especially because they're psych patients. You know, they're going to pull
Okay,
out the
well-
catheter. They're going to do a million things.
Okay,
That's
let's just
why
say
they
that
have to be
patient was in medical rule out.
Go to the MPU. I mean,
Yeah, so say they're in medical rule out and they now have received Levaquin because for their pneumonia. Levaquin is the only thing that's going to work for this patient. So they get Levaquin, they come to you now and you give them Haldol. I shouldn't do that. You know, I mean, stuff like that, like you know, is that, I mean, should you be held liable because you didn't think about the fact that you can't put Levaquin with, you know, things that mess with your Q, I can't even say it,
QT interval.
QVT.
Well, it's up to the prescriber, really, you know.
Well,
to know
no,
that.
here's what they're teaching
And
us.
then
They don't
and
even
then
know
there's
that
a
half the
check and balance
time.
at the pharmacy.
They're
Like
forcing
oh,
it down our
out of
throats,
hand.
but they're forcing it down our throats as brand new RNs and as student RNs that any medication administration, you are the last line of defense.
You are the
Mhm.
last
You have
line of
2
defense.
years of schooling. You have what, 5 months of pharmacology, and you have to know what the pharmacist knows as well as the freaking doctor.
You know, that
And
takes
it's
time to
scary.
understand.
That's
It is,
scary.
it's very scary.
It's
It's
Yeah,
super
like-
scary.
ignorant.
If you don't catch
And-
the mistake, it's on you.
Here's
And now
another thing about
apparently-
nursing.
I've caught mistakes
Here's
like that.
another thing about nursing. Dana, you're 20 years. How many years do you have, Desiree?
8.
Okay, so I'm just under you. I'm like 5-6 years at this point. For me, how nursing works, a big part of being a good nurse is you have to pick up those, not sentinel like people dying, but like those sentinel moments. Like one of my things that made me feel really good about like I'm going to be able to do this was I had a patient whose blood sugar was like going up and down and up and down, and you guys would probably know that as a brittle diabetic, right?
Yeah.
Are you familiar with that? Where one
Yep.
minute they're 300 and then the next minute they're 90.
Mhm.
And
Jesser,
I really,
Jesser, our friend Jesser is a brittle diabetic.
who?
Yeah.
Oh yeah,
Just
Yeah.
the one you need insulin because they
But-
tank. Yeah.
this is like one that you like. It's one of those things you learn and you keep it. You put it in your, you put it in your ammo belt and you keep that one because that's one that's going to save a life. And I had
Yeah,
a guy,
stick with
he
you.
went from like 300 to 50 and I caught it. They call them great catches where I work. And like every once in a while you'll get one
Do you
of
get
these
the
because you
pennant? Do you get the pennant, like the Great Catch pennant award?
Nah,
No?
I-
Okay.
I don't really, for me, I'm different with this. Like I got into this late in life and I love it because like, this is what I was supposed to do. I love like doing psych and helping people and
Mm.
just being the person that listens to them and goes through all that. But my medical sucks. I mean, it's good enough to keep patients alive in a non like hyper medical arena. But like on a psych floor, Dana will back me up on this. You get a lot of comorbidities. You get high blood pressure, you get diabetes all the time.
Mhm.
What else do you get, Dana?
Well, there's no IV.
Thyroid.
So
What?
you know,
Heart stuff.
everything's PO, so it's not, it's not invasive procedures in any way. It's just like, here's your pills.
But sometimes they push it on you.
Really easy work. I mean, you're not starting IVs, you're not putting up drips. There's none of that.
Dana, being a psych nurse is not easy. That is hard.
Oh, no.
I think coming from medical and going into psych, it's not that it's easy, it's different, but it's
Different. Mhm.
also a relief too. I'm like, just PO meds. Don't tell me as a med surg nurse or whatever, when you get, your patient load and you're like, you only have PO med, you're like, yes.
Yeah.
Kind of like always.
Yeah, but
like
I can
that
argue
type.
that
Again,
with you trying.
if I was a med surg nurse, maybe, but like, again, I'm like a weirdo person. Like I'm like, oh, my patient has all these too much, which probably they don't even take it home. They're like, they're not their Synthroid, like Lipitor, you got their Protonics, all the, thanks for being at the hospital medicines, here you go, all that. If that's all they're getting and they're in my ICU, you need to get out of there because you don't even need to be here, and now I'm bored.
Right,
So
right.
Well, to argue Dana's point, though, I can't wait to hear you after a couple of times where you've had to stick a needle in a butt that's moving all over the place and not sitting still for you, and you've got to have.
Once a shift.
It's like every day, man.
Yeah, so I mean, I like to think that all nursing, like when you get good at whatever you're going to be good at, then it's important. Like peds, it's got its thing, that's why there's separate departments. It's not like psych didn't get its own title because it's easier. It got its own title because you got to have a special skill set, which mainly involves just a lot of patience, not T with TS, but
Yeah, it's more
patience,
like
like being able to.
communication.
good therapeutic communication.
And it really important is these guys don't want to take their meds because meds have been a source of a great deal of stress for them in their lives. So you also have to know what can they do with and without, because a lot of times they're going to fake sleeping. They're going to not want to take their meds. So you got to really know which ones you got to push, which is why we have, do you have LARs where you're at, Dana?
What is an LAR?
So an LAR is like the patient hasn't been taking their meds, so eventually you have to get legally authorized representative.
No, because I don't have that. I'm not in a committed unit.
Okay, so with mine,
so basically you'd have to, like, how do you do that? Because you still can't
People that
force
are there
somebody
are-
to
wanna
take a
be
pill.
so say you got somebody that's not taking their Depakote, which is supposed to get them back to norm. Then you have to get because they're not taking it and they're still acting psychotic or whatever they're doing, maybe you have to give them a Zyprexa, 10 milligrams, 5 milligrams of Zyprexa to get them chill.
A doctor doesn't just say that. I mean, you have to be.
No, you usually they can't, because oftentimes these people are adults and technically
and they can refuse,
they're in charge of their own,
They're right
care.
here.
Right. So that's why you have an LAR. You got somebody that says, yeah, hit him up with the Haldol, or whatever. But yeah, so like I was saying, I love where we're going. This has been one of my favorite shows.
Hold on. So do you just have the right to just be acting a fool? Like, is that a right?
Yeah.
Okay.
Technically,
cool.
Here's what it is: harm to themselves or harm to others. If they're not doing those two things, I'm very much against. In 5 years as a psych nurse, I can tell you, I said it, Jack, so shut up.
I was waiting.
That's the first time though.
No, it ain't.
No, it's not.
I've alluded to it, but I have not actually said it.
Bullshit.
But die. Anyway, in my 5 years doing this, I have probably given less shots than anybody in the history of psych nursing. Like, I always try and de-escalate and get them to take the PO, because for me, with these patients, nobody listens to them, nobody trusts them, nobody validates them. So I'm always like, I give them every bit of rope to hang themselves and try and give them the PO first.
Mm-hmm.
Yeah.
So like, I'm big on getting away from it. It's just a different arena. But what you do, I'm never going to do that. Keep me away from anything medical. I don't even want to. I'll wrap a wound, and that's about the most medical I get. I'm good at that, and we get a lot of them. So that's kind of where I.
You fit right in with the psych. You have to be one to know one.
I'm fucking batty as shit. Yes.
Hey.
I've known you forever.
This is true.
Stop it.
Dana's a little squirrely.
That's why I like the ER, because we get our psychs. We get Baker Acts come in.
No,
And
but
Okay,
then
but what is
everything.
a bake rack? Explain that to
Then they
me.
do a
Oh,
tele
Baker
psych,
Act's an interesting one.
and we send them on their way. That's what I like about the ER.
No,
We see a little bit of everything.
Mary,
we treat or we treat it.
Mary, Baker Act is like only in Florida. Explain what a Baker Act is.
As when they're a harm to themselves or another, and police or someone else bring them in, and the ER doc determines they need a psych eval. Where we hold them on a
It's more than that.
72-hour hold.
No, it's more than that. We got that up here. Baker Act is we tried to Baker Act my mom. Baker Act is your family can say, my Baker Act is your family can say, yeah, they're fucking Fruit Loops. Take them in, put them in a psych ward. That's what a Baker Act is. Anybody can Baker Act you.
We
It has
used to
to be
do
done by
those
a
all the
ER
time in
physician,
court.
or it has to be done by a psych doctor. So we
Yeah,
do
you
psych evaluations.
You know what?
Yeah.
You know what's
Andy.
fun? You know what's fun? Being the lawyer that gets to sign the defense of that case and has to somehow convince the judge that the person should be released on his own recognizance. That's good stuff.
That's what Jack's done.
Meanwhile, they're going, I'm made of cheese.
Jack, are you an attorney?
Right.
Yes,
Oh my God.
yes, Jack is an attorney.
Because there's so many homeless in Florida.
perfect.
We have so many homeless walking into the ER going, I want to kill myself. And I tried to walk in front of a car, and then
And
we
they
have
really just want 3 hots and a cot.
because they made that statement. So then we do a tele psych, and then we have to have security escort them out of the building because they're not Baker acted.
No,
And they're just
because
looking for free
well, how
hots
about
and a
this? You get the homeless patients that come in and they're not really that bad.
Right.
They just want 3 hots and a cot.
Yeah.
And then security has to escort them when the ER doc and psych eval goes, yeah, there's nothing wrong with you. You need to go find a dark corner to sit in. Try another
Wow.
bus.
So
How about,
he-
that's
he-
what we call in
I
medicine
think we're
malingering. Is
Okay.
anybody?
So-
I know.
Lingering.
I
Yep.
know you guys are familiar with it, but Mike and Jack, malingering is when justice, there's kind of a, at least I firmly believe in this, but when I worked for the state hospital, we had this kind of rule of you don't tell them they're leaving until you got them on the elevator. Because if you tell them they're leaving a day before, they're gonna like write their name and poop on the wall.
They're gonna be
Because
like,
they
oh,
wanna
well, now my
stay,
stomach hurts.
and
Oh,
they-
my elbow itches. Oh, my
Yes,
eye can't
I'm
see.
having chest pain.
Yep, chest pain's a great one, they like to say.
And the only one, I really love where I work. For the most part, it's not really a part of all these problems. I mean, they do work the shit out of me, but they keep giving me bonuses, so I'm gonna come in and do it. But they're really good. But the
Isn't
one
that
thing
the
they
shits?
do,
Like, the money, the bonus is good. Like, I can't say no.
bonuses are great. In the
Plus
last, my
overtime?
last
Meh,
2 days of
all
work,
right.
I made $1,200 just for coming in and what I was doing regularly.
Yeah.
But the one thing they do is they tell these patients like 6 days ahead of time that they're leaving on like Monday. And
No.
that's when they punch another patient.
yeah,
Doesn't
they want to
discharge
stay in
the
there.
beginning of
Sometimes you gotta
patient-
tell these damn patients that the psych doctor is not the psych doctor, or they'll like lie to the psych doctor that they don't have. It's a,
Yep.
or they just don't talk to them. That's a good one that we see a lot lately. Like, they just won't say anything.
Hey, guys, going back to the case at hand here, does anybody know
Sorry.
exactly what the charge was that she was convicted for? Is it negligent
Criminally negligent homicide.
So she was charged with reckless homicide, and
Criminally
Okay.
negligent, yeah.
Homicide.
she was
Right.
charged. Well, no, she was
Criminally
charged with
negligent homicide.
she was charged with reckless homicide and impaired adult abuse.
Mm.
But she was
What?
found guilty of a lesser charge of negligent homicide and then also impaired adult abuse.
Okay, does anybody, now look, I don't mean to put you on the spot. If you don't know, you don't know, but does anybody know what the maximum sentence is for that?
The other one was 2 years. I think
6 years.
she's
6 years
facing up
and-
to 6 years, correct? Combined.
8 years, 2 years for the negligent homicide and 6 years for the impaired adult abuse. So 8 years.
So, so let's,
Wow.
She should have 0 years, 0 minutes, 0
so
seconds.
quick roll call. So Zeus was talking about this earlier. So with the nurses here, the Desiree and Mary and Zeus and Dana.
Well, Mary's not a nurse.
I'm a student nurse.
Yeah.
It's close enough. Close enough.
Enough.
So just do a quick roll call. Like, do you think she should lose her license? Do you think she should serve time?
Yes.
Do you, no,
Lose her
just one at a
license,
time.
get her
Zeus,
license.
She should not-
Desiree, you start. Then Mary, then Zeus, then Dana.
I definitely think she should have lost her job. Well, that sucks, but I mean, that's just
Mhm.
jobs.
That's
I
fine.
don't know if, I mean, I don't disagree that she lost her license. I'm not like, yeah, take a license. I mean, I get it, but the problem I have with it is there's been very similar cases that they have not lost their licenses for. So why this one?
Gotcha. And then I would assume you would want no jail time.
And no jail time. No, this
How
is
about-
not a criminal case.
How about you, Mary?
I feel like she definitely should have lost her job. She doesn't want to keep that job anyway. If she didn't lose her license, she should at least go through the IPN program or whatever program she has through her state and work with them to keep her license. And as far as criminal charges, no, I feel like the hospital should be held liable for that.
Gotcha. How about you, Zeus?
100%.
Oh, no, let Dana go, because mine's a little more
I'm
complicated.
just gonna co-sign.
No,
that.
it ain't.
Yeah,
I'm
of course.
co-signing Mary exactly what Mary thinks. That's what I think.
Okay.
I guess
Here's-
I guess it's also possible that isn't it possible that this gets overturned on appeal, or does that seem?
Well, yeah, I mean, right now that there's no appeals obviously in the works, but I'm very sure, I mean, of course they're gonna appeal this. They're probably gonna try for clemency. They're probably gonna try like a mistrial. I mean, something.
Yeah.
That case was, like I said before, very mismanaged, very poor. There's poor counsel. I
shocked that
mean,
it
there's
got
a lot of
this
reasons
far.
why there was case.
And it
shouldn't
was
be
drug
thrown
out for a very long time due to COVID.
Yeah.
That too. Mhm.
So here's why mine's more complicated, because, okay, there's a couple of things.
It's Zeus.
I lost a patient in like my first 6 months being a nurse. I was completely, I performed CPR after she was already dead. Like there was nothing that I did wrong. My problem is that bothered me to no end. And I haven't had the experience that you two ladies have, or even you, Mary, working in the ER.
I've worked codes. I've worked codes.
It doesn't even.
So
yeah,
I don't, but I
think-
haven't. So for that, for me, I've had one death, and
I had
it
one last one
crushed
worked.
me. It crushed my spirit for a really long time. It was like, can I do this? Like it really bothered me. And where I have a problem with her, I still do not think she needs to go to prison. I think I've made that clear, and I even do think that, yes, she should be able to earn her way back.
Sure.
Because how many lives did she save? One death, you can do that. But she went and worked for another year. And something about that, I can't nail what it is about
She did
that
not work in
bothers me.
patient care. She did not work in direct patient care though.
Yeah, but if you work in medicine, you still are involved with the safety of patients. I mean, at the end of it all, whatever she did, she was still in that arena. And I feel like there should have been a period, especially when she was so much more intimately connected with the death of this patient,
Mhm.
that I don't know. I think that if I did that and I was going to get away with it, I would still be like, I got to get away from this. I got to clear my head. I got to curl up in a
Yeah,
fetal
but
position.
you still got bills to pay.
Yeah.
Yeah, but
I
you
mean,
gotta
she-
live. But here's my thing: you gotta live to work to pay those bills. And that, for me, if I did what she did, and again, I don't think it was malicious or anything like that, and I can't even nail down what it is that bothers me about it. It just bothers me that this happened and she just went right back to work.
Well,
Yeah.
it's a subjective thing.
I don't
Yeah,
I don't
this
know
is
if
a
she went
me
right back
thing.
to work. I don't think she
Yeah.
went right back to work. She got fired like a week later, so she couldn't have gone right back to work. I think she was put on like administrative.
Well, they said she
leave.
worked
I don't
she's
know.
been working for like the last year. So
Yeah,
I mean,
Yeah, but this
not
happened-
arguing with you. I
so
don't know.
going right back to work is not. When I think right back to work, that's like 2 days after I just killed somebody. I'm gonna go do the same exact thing. That's
No,
not.
it
She
took
got
a good
fired.
year before she went back to work. A
Yeah,
good
she
year.
and
What's
she
that?
worked within that year in non-bedside care.
Yeah.
Okay, fair enough. So I rescind some of that. But I don't know.
It sits
Well-
uneasy with you. I get it.
Yeah, there's something I don't like about it. But again, like even just looking at her, just face value, I don't see a malicious looking person. What I've seen on TV, she looks remorseful. She stood up. She said what happened. You know, this is a really complicated one, but the one thing I will firmly stand by, unless they found out that she has 16 other patients that died the same way, I'm going to go with she shouldn't be in prison.
That would be ironic, right? They're not ironic.
Yes, that would be a little strange.
And it already happened 36 more times. So,
Oh,
yeah.
Probably with the same medication.
did you guys ever hear about that case where this is a long time ago, but the nurse, like, she gave like a bunch of heparin to a baby and a baby died and then she killed herself?
Jeez, no.
I heard about that on something. I forget
It
what
was
it
a
was.
very long time ago.
About it.
Oh, I
She
didn't know there was a
killed
documentary.
Child though. It was
But she what?
she killed more than one child though. That was
Yeah,
a
with
whole
all the
There
heparin.
was this guy. There was that guy doing to the death. He was killing people.
No.
Yeah,
This
that's like
was
a case
this
of
was
any
a
guilt for misery.
like
All
this is
different,
a
but-
second, what do they
I'm
call
your
it,
number
second
one fan.
victim syndrome or something, or second victim, I don't know. But she accidentally gave the baby too much heparin and then she felt so damn bad about it that she killed
Oh,
herself.
okay, yeah, that's a separate one. Okay, I'm thinking
Yeah.
of something.
The
Hey,
problem
Zeus-
is 37th victim syndrome.
Hey, Zeus, Mike, I could be wrong, but it feels like we've been on for a long time, no?
Yeah, I mean, we could do another one. I'd like to do another just medical episode, even if it's not tied to the subject, because this is fascinating.
This
love
was
it.
great, yeah.
you
I've
like
enjoyed
talking up with the nurses, Mike?
Yeah, I do.
Yeah.
Some very interesting stuff of what we do on a day-to-day basis. So.
I believe so. Yeah.
I'm
All right,
interested
so-
in learning anything I can from nurses, so
How
I'm
about this?
I'm
We'll
that
have you all
little-
back on again some point.
Yeah, let's do another one on another subject that's medical, that's nurse related.
Oh,
So
the-
we
the
I
subject
want one
matter-
last thing.
Yeah.
And then Jack can do his send off. We're good at predictions. So let's do our predictions on this.
I don't think she's
How
gonna
do you
serve
feel
a
like
day.
this-
I think she's not going to serve anytime.
I agree with you, Mike.
Me too.
Well, I liken it to the what was our little fella with the BLM and the guns? Rittenhouse. I think it's going to end up very much like that. That everybody's screaming bloody murder, and then at the end of it, they're going to go, yeah, not so much. I think probably won't see a day.
Well, the problem is she's already been convicted, so there's
Yeah.
a lot of pressure to give her some time too.
Yeah.
Yeah. That's
know?
what worries me is for some reason, you know, a year and a half ago, nurses were heroes. You couldn't go anywhere in scrubs and not have people paying for your food or throwing shit at you or giving you money or praising you.
Oh,
And
I get
now
people throwing shit at me all the time.
nurses are under fire for some reason. The
Well-
government is going after nurses, and I don't understand why.
But
Because
still
they're
heroes to
paying
the
us too
people.
much.
They're going to rely on us, and we have a shortage of nursing.
Yeah.
You're gonna have a bigger one.
Stop scaring us
You
off.
know, it's always been said that if we ever wanted to create change, we have to unify and organize.
Yes,
And we can
100%.
absolutely change everything in this
We need
country, but-
unions.
But we don't. We just don't do it. It's amazing, but we could if we really wanted to. And I think that if this didn't go in the way that, I agree, Mike, if it didn't go in that way though, all hell is going to break loose.
Oh, it is.
How
Yeah.
about this? How about if she goes to prison and she does the whole time, it may actually destroy the possibility of nurses ever having unions. I mean, there's a few nurses unions, but overall it's not a unionized job, and it very much should be.
Well,
I'm in a union for both my nursing jobs.
I hate
I'm
you.
unionized.
Are you in a union, Mary?
We have lots of unions in Florida. Most facilities have nursing unions. The sad part is if you take a charge position, you're not allowed to be in the union.
Oh,
that's
that's interesting.
Because that's the one that controls all the other nurses, obvious.
Yep. If you
So
take
Mary, what do you
management
think? You
charge,
think she's
you are
gonna
not
see
allowed
time?
to join the union, and they won't let the union rep step foot on the hospital property.
Nope.
Hmm.
So what do you think, Mary? Is she gonna see time?
No, I
Okay.
hope not. I
You all
don't think
agree?
so.
Not.
I think she has a very strong backbone behind her. There's more nurses than people realize, And I think she has a lot more people behind her and a lot more associations behind her. And they're all pointing the finger at Vanderbilt.
Mm-hmm.
I think she's got the backing of the Friends of Zeus podcast. I think
Absolutely.
it's going to go a long way. I think
she
this
like,
may be
if-
the
if
turning
she's
point
smart,
for her.
She could sue the hospital and she'll be a very rich woman at the end of all this. She won't
Yeah,
have to work, and she won't have to work.
exactly.
One
All
thing
right,
I'd
well-
like one last thing I'd like to say, Jack.
Yeah.
For everything we've said here, you know, like I'm saying that I think she should, you know, lose her license. If she ever does happen to hear this, I fully support her on the things that I can. I think we all probably do.
Yeah.
But you know, I'd just like to know that if she ever heard it, I don't hate her. I feel bad for her. I feel like it was a hurricane that just landed in her lap.
Let's invite her on.
This podcast.
We'll invite her on.
I was
Yeah.
looking for lawyers.
Yeah, no,
Really
that's the end. Well, I would like to say before we go, thank you, Desiree. Thank you, Mary. Obviously, thank you, Dana, as well for joining us.
Well, thank you for having me. I appreciate it.
Thanks.
All right, guys.
Thank you.
Yeah, we have been on for a little while now, I'd say. This was a great episode, but I think it might be time we wrap things up.
Yeah.
Let's do that.
See you next time, everyone in podcast land.
Bye, guys.
Bye.
Thank you, guys.